The FDA has authorized the Pfizer BioNTech coronavirus vaccine. They did it on Friday night. Now, it came under a cloud of allegations that either Trump or his chief of staff, Mark Meadows, or someone called the FDA director, Stephen Hahn, and said, approve this today. And when Stephen Hahn was interviewed about that over the weekend, he didn't deny it. He just insisted everything was done based on the science. And to me, that's a pretty clear non-denial. But the point is, we now have an approved vaccine. This same vaccine has been approved in the UK. It has been approved in Canada, and now it has been approved here in the United States. Vaccination starts today, as far as we know, with high-risk healthcare workers believed to be getting top priority in all 50 states. Ultimately, states decide how to allocate and prioritize the tranches of doses that they will be receiving. We have 3 million doses already fanning out across the country via logistics and shipping companies over the weekend. 145 different sites will be receiving the vaccine today, another 400 sites tomorrow, another 60 something on Wednesday. Now, there is not nearly enough supply. Even if now we say we're just doing medical workers, we don't yet have the supply to inoculate every doctor, nurse, hospital security guard, receptionist, phlebotomist, other workers who risk being exposed every single day. We just don't have enough doses yet. Because the vaccines can cause side effects like fevers and aches for a day or two, hospitals also can't, even if they had all the doses, they can't give it to everybody at once because everybody might be out sick the next day. Obviously, it's only a fraction that actually get the side effects, but you have to stagger it in order to avoid even the possibility of that. So this is going to be a process. Residents of nursing homes who have been disproportionately suffering the death by coronavirus are also expected to be top priority. And again, this is all based on expected shipping. We're expecting to see some nursing home residents start to be vaccinated next week. New York's first coronavirus vaccines have arrived, and we're expecting vaccinations today at Long Island Jewish Medical Center and maybe even a couple of other locations. Most people's eligibility based on prioritization is likely to put them sometime around spring for being able to get a vaccine. The New York Times reported that the administration had a plan to vaccinate all of its own staff, including people that work around Trump, even though these first doses are supposed to go to healthcare workers. And apparently there was not good reaction to that. Donald Trump canceling that by Twitter yesterday, saying, quote, people working in the White House should receive the vaccine somewhat later in the program, unless specifically necessary. I have asked that this adjustment be made. I am not scheduled to take the vaccine, but look forward to doing so at the appropriate time. Still, we are going to have to deal with vaccine hesitancy issues among some, and that's raising questions about whether all available doses will even be requested once we get. My expectation is now, with the doses going to healthcare workers and still not having enough for all of them, every dose will be spoken for now. In the nursing home phase, I believe every dose will be spoken for. Once we get a second approved vaccine, Moderna more than likely, and we see the next layer, which is likely going to be the oldest folks, if you don't have the demand that you expect, and as of right now, 60% of the country plans to get the vaccine, 40% of the country does not, you could have a situation where even these early batches of doses don't get swept up. And in that case, there's going to be some real questions. Now, the idea would be that over time, as you start to see, oh, my kid's school requires that parents be vaccinated. I don't know if that's possible, or eventually if the vaccines are open for kids, the kid to be vaccinated. Or if I want to fly with this airline, I have to be vaccinated. If I want to go to a sporting event, I have to be vaccinated. That will probably push the number of people wanting the vaccine up from 60. They will call it a mandatory vaccination. Of course, it won't be. It will be, if you want to partake in a certain service or business, then you have to choose to go and get a vaccine. It's up to you ultimately. But we could have a situation where, because of underuse of the vaccines due to lack of interest, you're going to have a situation where people may well be able to jump the line. And what I mean by that is, if hospitals are giving the vaccines to their workers, they know who qualifies. If nursing homes are giving vaccines to their residents, they know these are our residents. Once you get beyond that, from what I've been reading, CVS and Walgreens aren't going to check. Do you really have diabetes? Do you actually qualify right now under you have to have one or two comorbidities? And so the opportunity to jump the line is likely to be a real thing. Now, at the same time, if not everybody wants the vaccine, you may have doses left over. And I don't know how it's going to be chaotic to some degree. My approach is going to be at no point will I act in a way where I am taking a vaccine away from someone who's higher priority than me who wants it. If it becomes clear that the doses are not actually being swept up by the people who are next on the list, and there's an announcement of come and get one or pay $100 and come and get one because we have doses unclaimed that will go bad if somebody doesn't get vaccinated, I would absolutely do that. But I have no interest in jumping the line if it's going to actually take a vaccine away from someone who is up next in terms of the vaccination protocol. That's my mindset. And we're going to take it a week at a time and track the number of people who have been vaccinated, remembering that you're not considered sort of at maximum inoculation until 7 days after dose number 2. Very, very important to remember that. Let me know where your head is on vaccination. I'm on Twitter at @Pakman. We'll take a quick break and continue with more right after this.